Howdy folks, I'm Cheery Checkered White, cheekily checking out crude comedies.
I'm Amber.
And here are more crude comedies for us to check out because I guess that's what butterflies do. They're into raunchy humor. Gross, butterflies. Maybe go buy yourself a better sense of humor and a better pair of wings.
Checkered whites are very pretty. I mean, I haven't seen them in person because they're not in our area, but
I was just being mean, and it's to make myself, which I'm the checkered white. And folks, if this is your first time viewing or you're a new subscriber, then welcome. This is a show where we teach you how to violate other people's bodily autonomy for the next 20 minutes.
we show examples of that, but do not imitate them. That would be bad.
Life imitates art. Let's get started. Alright folks, and our first letter is titled, Am I a Jerk for Telling My Husband That His Mom Can Watch Me Give Birth If My Mom Can Watch Him Have His Prostate Exam? I'm a 25-year-old female and my husband is a 31-year-old male, and we've been trying to have a baby for the past 5 years. We finally succeeded, and now I'm 36 weeks pregnant. Recently, I've been finalizing my birth plans and talking to my doctor about what I would like to happen during both and after the birth. We were over at my mother-in-law's house one day while me and my husband were talking about it. She overheard us talking about it and commented that she's excited to be there during the birth of her second grandchild, and how it's so weird that I was doing everything completely differently than she did back in the day. I was confused on what she meant by that, because I assumed that it would just be me, my husband, and the midwife in the room while I gave birth. She didn't take the news particularly well and started to get increasingly upset each time I told her that she would not be in the room with us. After a while of me telling her the same thing over and over again, I finally left. I went home and my husband stayed with his mom. When he got home, he told me that it was selfish for me not to let his mom have this experience. I kept trying to explain to him my boundary and how weird it was for me to have a woman that's never seen me without clothes on before watch me push out a child out of my vagina during what will probably be one of the most difficult and vulnerable situations of my life. I finally got tired of arguing, and I packed a bag and I left to stay at my sister's house. We have not talked much since then, and it has been about 2 weeks since then. Today, I had a doctor's appointment with my OBGYN, and my husband thought that it would be a good idea for us to go to have lunch together and try to work things out. He's still stuck on the idea that his mother should be there in the room with us and wasn't even trying to see things from my perspective. So I told him that his mother can be in the room with us if he allows my mom to watch him during his prostate exam next week. I also told him that if his mom wants to videotape me, then my mom should be able to videotape him during that exam as well. He got mad, saying that it's ridiculous that I'm even suggesting it and that it's an invasion of privacy. Of course, I wasn't actually going to let my mom do these things, but I just wanted him to know how I felt. But now I feel kind of bad because he is really upset, but I don't know what to do now, and I don't want to give birth without him. But I may have to if we continue to go down this path. All right, folks, what do you think? Jerk or not the jerk?
Not the jerk. I mean, the audacity of this man to be like, that's an invasion of privacy. Well, you know what is also an invasion of privacy? Having someone you don't want there while you're giving birth. That is a very, very private and intimate moment, and only people that the person giving birth wants to have in the room should be in the room.
Well, and that's kind of how I view things as well here. I think that he is missing the point, right? OP is showing him why this is kind of an invasion of privacy. And they're trying to demonstrate it in, I think, a compassionate kind of way, right? Like framing it in a, look, you wouldn't want my mom to watch you get a prostate exam. Why would I want your mom to watch me push a baby out, right?
Yeah.
And so maybe OP could have phrased things better. Maybe they could have been like, said it in that way. But, it feels like there's a lot of communication issues in general in this relationship, and maybe they haven't developed a lot of healthy communication skills.
Well, it seems like everything was fine until his mom started pressuring OP or the husband, getting in his ear about this. And now is the time to resolve this, because if this doesn't get quashed right now, what else is she going to want? Like, she was going to want to be in the delivery room. Then what's her next request? And like, if the husband is always caving to his mom, he's not going to be a good partner to Opie. He's not being a good partner right now. He's putting his mom's wants over Opie's needs.
Yeah. Oh, and I also think that there are other signs here that there may be some really unhealthy dynamics. The fact that they've been trying to have a baby for 5 years and OP's 25, right? And so that means that he would have been, 26 at the time. And, that means that they had to have been dating at least even before that, right? So probably were dating before that. So they got married young, it sounds like, and immediately started going into, wanting to build a family and stuff like that, right? And I think that that can really be problematic because it may have not allowed them to kind of like develop the skills for communication and stuff like that if they're just immediately jumping into like family planning mode and stuff like that. So I don't know. I mean, that just kind of doesn't give me the best or warmest feelings.
I mean, I think it's fair to point out that they got married and started trying really young, and so they haven't like had any time to grow and get to know each other.
Yeah. What do you think of the mother-in-law's reaction in all of this?
I mean, I think that she just needs to back off and accept that this is not her body and she doesn't get to control other people.
Yeah.
Like, I think her reaction, like, I can understand her asking if she could be in the room, but as soon as she gets a no, she needs to accept it.
Mm-hmm. But let me know what you folks think. So anyhow, take care and good luck. All right, folks, and our next letter is titled, Am I a Jerk for How I Told My Brother's Girlfriend That Sperm Doesn't Help with Acne? So, throwaway account because I don't use Reddit. Fake names to protect privacy. Me, a 37-year-old male, and my brother, Hank, a 34-year-old male, are both medical doctors. My pet peeve is medical misinformation, so when I hear it, I'm quick to call it out. My brother's girlfriend, Jane, a 25-year-old female, is kind, empathetic, and successful, but is not an academic. The three of us, plus my wife, Kelsey, a 39-year-old female, were hanging out, and Jane mentioned something about using sperm to help with acne. Without thinking, I immediately told her that that was a myth, and is probably still popular because guys use it to trick women. My mind wasn't on Jane's adult acne until I said that. Jane turned to Hank and asked him why he told her that then. Hank said that he was joking when he told her. Jane wanted to leave, but she had been drinking, so my wife offered to drive her home. Well, Hank has asked me why I told his girlfriend that in such a way. I told him that he shouldn't have told her that in the first place, and he said that it was a dumb joke. I told him that if so many people believed medical information from influencers on Instagram and TikTok, imagine how many people will accept medical misinformation from an actual doctor. He said that the way I said it made it seem like he was lying to her. Am I the jerk? Edit. I was on the fence about if I should bring this up before, but I think that I should. Please don't let this make you scared of doctors. My brother and I are both dermatologists. The vast majority of his patients are women in their 20s and 30s. If I really think about it, the vast majority of the women that he's dated had adult acne. Edit 2. I told my wife my suspicions, so she talked to Jane, and she talked to another woman that she knows personally who are my brother's patients. A patient in her 30s who is neurodivergent. My brother told her to have her boyfriend do that to her as well to help with her acne. We definitely need to report my brother. All right, folks, what do you think?
Yeah, definitely not the jerk, and report brother ASAP. He
Yeah.
should not be practicing. Like, what he is doing is disgusting and inexcusable. This is not a joke. This is not funny. He is deliberately misleading women to get like his fantasies fulfilled and get other guys' fantasies fulfilled.
Yeah, so this is sexual assault
Mm-hmm.
and coercion, and that's not good, right? I think that this is a really important discussion in the respect that all, decisions that you should have should be, informed consent,
Mm-hmm.
right? And if this was something that she wanted to do out of informed consent because she, wanted to help fulfill a fantasy of her partner's, that's one thing, right? However, if if he's trying to use this as a way to, gratify himself sexually, then, that again is sexual assault, plain and simple.
Right.
He is not a good person, and this, I hope, gets his medical license revoked because he does not need to have patience, right?
Right. I mean, especially not when he's abusing his power and authority like that,
Yeah.
because generally we trust our doctors to tell us the truth.
Yeah.
And like, he shouldn't have said it to his wife, but especially saying it to a patient in a clinical setting.
Yeah.
That is 100% not okay and like probably illegal.
Oh yeah, and I mean, I would not be surprised if this ends up with him going to jail, right? I mean, that's plain and simple, and
Like, because it violates all medical ethics.
oh yeah, this is just completely throwing medical ethics out the window at this point in time. I mean, and he deserves to go to jail for something like this, right? I mean, he has done some pretty horrific things if he's lying to his patients, spreading misinformation, and using it to involve people in his own personal gratification.
Yeah, well, and it seems like predatory too.
Very
Like he's
predatory.
picking on people who he feels are more vulnerable, like, the
Yeah.
neurodivergent woman. And then it was mentioned that Jane, isn't necessarily the sharpest tool in the shed. Like seems like he's specifically picking on women who he knows he can manipulate and control.
Well, to even add to that, right? People who have facial acne are a lot of times desperate to get rid of it, right? And he's using someone's desperation to basically fulfill his gratifications. And that's putting someone who's already in a vulnerable position and making them even more vulnerable, right? And that's it's really just awful. It really is awful. There's just no words to express how terrible of a human being this is, right? And the fact that he's in a position of power that he, doesn't need to be in is just simply disgusting, is really what it boils down to. But let me know what you folks think. So anyhow, take care and good luck. Not the jerk, and he took advantage of insecurity of hers to get what he wanted sexually. That's coercion at the very least. He is also in the position of a power over not only her with the age gap and the knowledge gap of him being an academic, but also with the fact that he is a medical doctor. And he also lied to that woman who you thought was nothing but kind. Your brother is a jerk, and you should have rebuked him more. I mean, I think that when you're in a situation like this in the moment, it can be difficult to even find the right words to do that. But I do agree that maybe OP should have been harsher on their brother.
Well, I mean, I think OP is doing the right thing now. And sometimes having a smaller reaction in the moment isn't necessarily a bad thing, because the brother could have tried to immediately start covering his tracks if he knew OP was thinking about reporting him.
Yeah.
So in some ways, like, I'm not saying there would be anything wrong with rebuking the brother harder, but like, if OP is now able to present credible evidence that he has been, manipulating patients and help get his brother out of practicing medicine, that's going to be a much bigger good than just making his displeasure known to his brother.
Yeah, and that's a fair point. And Hobo Renegade says he might have actually believed that this was true. It's a myth that's been out there for a while. It's still prevalent enough that health sites and lifestyle zines and blogs still go all the way out of their way to debunk it. Well, even back in high school, in sex ed, it was one of the myths covered in class, along with BS like masturbation will make you go blind or give you hairy palms. And I am an NPC, so what says, his reaction says that it was an intentional lie. And Hobo Renegade says, haha, how did I miss that? And OP replies, I do suspect, but I cannot confirm that it was an intentional lie rather than a joke. But I can confirm that it is a fact that he knew long before that this was a myth. And I mean, I think that's probably just because OP and him are both dermatologists. And Kitten Dolly 13 says, not a jerk, and I'm glad that you're going to report him. I can't help but wonder if he became a dermatologist specifically so that he could prey on young women. And OP replies, our mom is a dermatologist. Alright folks, and our next letter is titled, Am I a jerk? I absolutely hate certain things, yet my friends still try to do it anyways. So one thing that I hate is hand sanitizer. I know that it's weird, I just can't get past it. I tried. It makes me so bothered, and I just want to itch my skin right off and rip it off. I recently cut my toe while moving something and I cleaned it with some soap and water. It was almost fully healed, but today my friend kicked my foot in a way that it slid across the inside of my shoe and slightly opened, so I told him to get me a band-aid and he came back acting weird. He showed my other friend, who had some hand sanitizer, and was hiding it. I saw it and I refused it. We did this for over 30 minutes where they tried to trap me and get my foot in it and all that kind of stuff. The friend, who finally wiped it down with hand sanitizer on me 3 times knowing that I don't like it because I wouldn't let him put it on. In the end, I didn't even get close to having it cleaned with soap and water. I just put on my shoe and such and I went back. I'm irritated because I hate the smell and feeling of hand sanitizer on me ever since I was a kid. I always had problems, like I hated socks and underwear and all that. I used to scream and cry and claw my skin off if it was touching me. I've gotten over those things, but hand sanitizer I just can't. I don't know if it's a sensory thing. I know that it's a weird and stupid thing, but I feel upset and gross because I hate the feeling of it. It's like there's something wrong with me. They made it sound like it was such a bad thing not to want hand sanitizer on me whatsoever. Is it? Am I overreacting or am I the jerk? All right, folks, what do you think?
No, absolutely not the jerk. And these people are not your friends if
Yeah.
they're willing to violate your bodily autonomy like that. First of all, hand sanitizer is not a good substitute for soap and water. Like,
No,
it's kind of
no.
one of those things, like, if you don't have something else, it works. But, like, if you have a wound, you really want soap and water to clean it.
Well, that's it, right? Like proper wound care is soap and water generally, right? You want to wash it and you want to wash it thoroughly. And the fact is that hand sanitizer can also cause like tissue damage and
Yeah.
stuff like that, right?
Yeah, because of the alcohol. And so, like, what they were doing was not best practices, but even if it had been, you know, you are the one who with the injured toe. It is up to you to decide how it's treated. Them assuming that they know better than you, that's like the most charitable assumption is they think they know better than you, which isn't great. Or they deliberately are doing this because they know you don't like it and they want to force you to get over this. Like, there's no good answer for this. It's not okay. It's not excusable. There's nothing wrong with you having sensory aversions.
Well, and that's that too, right? I mean, like the fact is that even if this was the best way to care for a wound, OP is allowed to make their own medical decisions and has a right to their own bodily autonomy and to make those decisions. Just because something is the preferred medical way of doing something doesn't mean you have to do it that way, right?
Right. And I mean, that's why adults are allowed to determine their own medical care and to decide on whether they want procedures or not. Even a medical doctor cannot force you into a procedure you don't want.
Yeah. So no, I don't think that OP is wrong here, and I think that OP was violated here, right? This was abuse that they enacted on OP, and these are, again, like you said, are not OP's friends. These are people who are going to force their will upon OP. It's not a good situation. But let me know what you folks think. So anyhow, take care and good luck. And Rockology Adam says, not the jerk. As soon as your friends force the hand sanitizer on you, they are absolutely unmitigated jerks. Whether it's a case that you always hated hand sanitizer, preferring soap and water, or just hating the smell of a particular brand, it doesn't matter. What mattered is the fact that you said no and they did it anyways. It frankly doesn't matter what your reasoning is for not liking hand sanitizer. It's a valid personal choice. Maybe, just maybe, in a world where you are dependent on people for your care, the people whom you are dependent on would get to make this choice for you. But that is a very, very small group. Even if you are going to leave it dirty and fester, they don't get to force the hand sanitizer on you. Preferring soap and water as an alternative? What in the world is their problem? And Cat says, soap and water is proven to be far more effective than hand sanitizer, and hand sanitizer should never be used instead of soap and water. How would you feel if surgeons just slapped some hand sanitizer on instead of scrubbing it in? OP is not the jerk. And Rockology Adam says, to be clear, this is for general discussion and not OP's case. We agree here that friends are completely out of line. But there is a place where hand sanitizer is going to be better than nothing if soap and water are an hour away or more. However, it's still always going to be your own choice whether you use sanitizer then, not someone else's. All right, folks, it is tea time. Grab your beverages of choice. I've got some tea right here, and Amber, she has a joke.
What might you call a slumber party for baby chicks?
I would call a slumber party for baby chicks a zombie bird party because we are in the month of zombies and we need to tie this to zombies somehow. And so that's the best way, is just to throw hand your way in there with the word zombie somehow.
A peep over.
Oh, a peep over with zombies.
No, there's no zombies in this. And it's National Sleepover Day.
Oh.
And it's also National Alphabet Magnet Day.
Oh. So go find yourself some alphabet magnets and have a sleepover with a bunch of friends, and then decorate your fridge with a bunch of poetry, and make sure that that poetry is purely zombie based.
I mean, I can get behind some zombie based poetry.
Yes. And I have Earl Grey. All right, folks, that's all the time we have for today. Thank you so much for watching. Happy Fantastic Friday, folks. I hope your Friday is off to a fantastic start. Amber, we need some kind of moral advice and or guidance, and please have it on bodily autonomy.
Respect other people's bodily autonomy?
Yes, I think that's a great and wonderful moral. Thanks so much for watching, and we'll see you all tomorrow.
Bye!